everybody. Today I'm going to talk about a pelvis setup. This happens to be our TrueBeam. I have the patient pulled up on the screen. This is our mock setup. And it shows that I'm treating a pelvis patient with a F headrest. Here's the headrest. It says an F right here. In addition, we keep our other headrest over here, and they also, this one says it's a B headrest, just to show in comparison the headrest. I already have the patient, the room set up. I have a sheet on the table. I have the F headrest underneath. I also have a pillowcase, and this is to cover any area of the pelvis that we do not need to expose for the patient as far as modesty. In addition, according to the setup notes, the patient feet will be banded. They are straight, but they're banded so that we keep the legs in the same position for treatment. So now I am ready to bring our patient in, and today just happens to be her first day. Okay, so I'm going to go get our patient. This is her first time in today, so there's a little bit of a different protocol that we're going to have to follow. I'm going to explain to her all the procedures that we're going to be doing and the time she's going to be in the room, as well as a couple different things with COVID that she's going to have to be required to do before she comes in for treatment every day. So this is our waiting room for the patients. In our clinic, the men are on one side, the women are on another. So I am looking for Mrs. Doe.
That's me.
Okay, come with me. So what we're going to do today, it's your first day. We're going to set you up in the same position that you were set up in the simulation room. Mm-hmm. And you'll probably be in the room for about 15, 20 minutes. We're going to go right in here. And due to the COVID virus, we're going to have you call into our clinic every day, and you'll tell us if you have any symptoms that correspond with the virus, such as headaches, fever, coughing, respiratory, any issues like that. Okay, you'll call it in, you'll just tell us what your temperature is, and you'll also be checked additionally at the front of the hospital when you first come in.
That looks really big.
Yes, this is called our TrueBeam. It's a linear accelerator. This is where you'll have your treatment every day. So we're going to have you sit up over here on the table.
Mrs. Doe, could you tell us your name and date of birth, please?
Yes, Jane Doe, 12/8/65.
Thank you.
Okay, so I am going to verify her name and birth date with everything that's on our monitor after we brought her up. And her name is Jane Doe, and her birthday is 12/8/65. Perfect. So you'll sit right over here, and your head's going to go right here. You can just sit on there. We'll pull up your gown. Okay, so we want to make sure you're really straight on the table. There you go. Lay back. So nothing in here is going to hurt you. We're just going to set you up, like I said, the exact same way. So your legs are straight, and then her feet are banded. And then your hands go on your chest. So here's our mock tattoos that we're using just for the purpose of our presentation. So we're going to move you around to get you in the right position. All you have to do is lay heavy. Don't try to hold the position, and don't try to help us. We'll do all the work. So I'm going to go ahead and turn the lights off. The lasers that are coming out from the side of the room, they help align you in the proper position. So just for purposes for our video, I am lining her up using the table controls and the pendant. And Cindy on the other side is just manually moving the patient to get her in the right position. To us aligning her in the same position, then we have to move left and right with the laser to make sure we're centered, and we are doing that. Okay, after everything is all set up correctly, we verify everything with the setup notes. Oh, I do have to ask you, Mrs. Doe, the doctor does want your bladder full for treatment, so we're gonna check on a CAT scan, but did you do the protocol with
Yes.
the water?
Drink 16 ounces.
Okay, so now I'm gonna turn on the lights. I'm gonna tell the patient that we're right outside the room. We're watching you closely. We can hear and see you at all times. If you need any